Meeting has been called to order. If General Counsel can give us a report of the actions taken in closed session, please.
Yes, thank you, Chair Wong. The board considered 7 items in closed session. I would refer you to the agenda. The first 5.1 through 5.5, there was no reportable action. 5.5, approval of the closed session minutes. Those were approved unanimously, 5-0. 5.6 is being continued by the board until after the open session, so it'll be continued until item 19. Item 5.7, medical staff credentialing, was approved on a 5-0 vote, and there was no reportable action on 5.8. And that concludes my report.
Thank you so much for that. Are there any deletions or corrections to our posted agenda? Seeing none or hearing none, we'll move on to item 10, input from our audience. And this is an opportunity for the public to address the board on any topic that is not included on the agenda. Any speaker that comes, could they come to the podium? The microphone is on. You can give your name, and you have 3 minutes to present. And again, because it's not been agendized, there can no longer be a discussion on it.
So, can you hear me? Yeah.
Barely.
Okay. It's nice to see you all again. For the record, my name is Deirdre Henderson. I am a resident of Truckee, a patient at Tahoe Forest, group leader of the North Tahoe Chapter Citizens Climate Lobby, and co-lead of 100% Renewable Truckee. We noted that in the COO's report at your last meeting that there was a note that you were entering into a contract with Mazzetti Engineering to do a greenhouse gas emissions inventory, scope 1, 2, and 3 emissions, with recommendations for action thereafter. We are very pleased and very grateful that you are doing that. That is a preliminary step to considering appropriate climate action that we have been urging for the past year or more that we've been visiting you here at your meetings. So we are very pleased with that, and thank you very much. We did do a little research on Mazzetti Engineering, and we were very pleased about their qualifications to do this. Mazzetti describes itself as an employee-owned benefit corporation committed to creating healthier, enduring environments. As designers of healthcare facilities, we take it as a moral imperative to help our clients build strategies and infrastructure that will simultaneously withstand the rapidly changing climate and bend the climate curve backwards toward health. So we are looking forward to their report. We are wondering about the timeline for delivery of that report and your plans for sharing the results. I know you can't give answers tonight, but we would appreciate knowing about that as soon as you know. I also wanted to mention that Mazzetti has been funded by the California Energy Commission to create a guidebook to help hospitals decarbonize their facilities. That guidebook is largely available online now at decarbhealthcare.com. And we've taken a look at it, and it's very well done, very helpful. So we're very hopeful that this will be a good report and a good start to your climate action activities. So thank you again.
Thank you for your comments, Ms. Henderson. Are there any other comments from our audience? Okay, then we'll move on to item 11, which is input from our Employees Association. I don't see anybody from the Employees Association at this time. So then we will move on to Dr. Koch and the Medical Staff Executive Committee report.
So to review the consent agenda today, we have only one item, and that is the ICU policies. And they are listed here. There are a lot of them, and there were no changes in any of them, and they have been previously approved by the board. Do you have any question? And all of them were, well, a spot check was done to make sure that the risk statement was included, and it was in the spot check that we did. Do you have any questions for me about this?
No. Okay. They've gone through all the layers that have to approve them, so we're
Correct.
good. Especially since you've done a spot check.
All right, well, that is my report.
All right, so can I have a motion to approve the Medical Executive Committee meeting consent agenda as presented? Oh, I'm sorry, public comment.
Move to approve?
Okay. If there are no comments, can I have a motion?
She did a motion.
Move to approve.
Okay. Okay, a second, please.
Second?
Okay, it's been moved by Director Brown, seconded by Director Barnett, that we approve the Med Exec meeting consent agenda as presented. All in favor?
Aye.
All opposed? Then your agenda has been approved. Thank you
you.
so much, Dr. Koch. Our next item is the consent calendar, and these are usually non-controversial documents or reports, but any member of our board can pull one. Our staff also, if they have an interest in finding out more, knowing about it, can pull an item. So is there anything from our board that they would be interested in pulling? No. Anything from our staff? Okay, no. Any comments from our audience? Okay, none. So can I have a motion to approve the consent calendar as presented?
So moved, Dale. I'll second.
Okay, so it's moved by Director Shamlin, second by Director McGarry, that we approve the consent calendar as presented. All in favor?
Aye.
All opposed? So the consent calendar is approved. Our next item for board discussion is our biannual retirement committee update, and we have Brian Montanez. Is he on Zoom?
Good evening, everyone.
It's only a discussion.
Lead decision maker. So having a new team step up to make the decisions where somebody else made the decisions, where somebody else made the strategy, where somebody else made the buy and sell decisions, that's something that causes us concern. So while we have high hopes, we are going to watch it to see if the new decision makers, the new lead portfolio managers, of which there will be two rather than one, if they make any changes in the fund or in the investment thesis or in the execution of the thesis. However, JP Morgan is a fine asset manager. We are very comfortable with the organization. We're comfortable with the transition. The question is, will the new decision makers make any change? So we're putting on a watch list as we continue to watch that portfolio. The Invesco Developing Markets, which is an emerging market fund, has also been placed on the watch list. This particular fund has had some challenges since the Russian invasion of Ukraine, and the performance has been questionable since. So we are putting on a watch list so that we can discuss with the portfolio managers what they're doing, why they're doing it, and what the results are. No real concerns about JP Morgan, questions about Invesco, and I will discuss that with the Retirement Plan Committee next week when we meet. The remaining funds remain satisfactory as determined by my investment committee. From a participation rate, the hospital's retirement plans have excellent, and I repeat, excellent participation rate. So from June 30, we went from 80 to 85.9% participation rate in the salary deferral plans. These are really good numbers in the retirement industry, let alone in the governmental plan industry. These are really strong numbers. The deferral rates are also exceptionally strong. 9.7 in June, that actually increased to 10.1 in December. That's salary deferral. That's how much people are putting away of their own money. Very, very strong numbers, and I credit the HR department to their communication strategies for this. Total savings, which is employee and employer, remain the same at 14%. Keep in mind, new people are being enrolled at 6%. At some point in time, they will ultimately change that and hopefully increase it, which is what we've seen as people are increasing their savings rates. But new people are brought in at 6%. So the total savings, employee and employer, remained at 14%. Keep in mind, 14 is an incredible rate. Most financial planners say the average participant should be saving between 10 and 15% for their retirement. Your staff, on average, are saving 14% combined employee and employer. So those are great numbers. From the committee activity perspective, in Q3 of 23, we did meet and we reviewed the investments. Everything looked good. We did our biannual investment menu review, and this year we elected to consolidate some positions. So before I go into it, first keep in mind, in the U.S. equity markets, there is a high correlation between large cap and mid cap, and even small cap and mid cap. And behavioral finance shows that less is more. I know most folks think, let's give our participants more options. That's better. That's not what behavioral finance shows you. It'll show you that less is more. So the committee agreed to merge the 500 index and the, pardon me, there's something wrong with my Adobe there, to merge the 500 index and the small cap index, as well as the Vanguard Social Choice product. We did discuss, should we expand the ESG investments? And the committee elected not to, so we elected to consolidate the ESG investment into the total market index. So we removed 3 positions and we consolidated it to 1 position. That is truly in the best interest of participants. However, the committee also acknowledged that if participants had an interest in doing something outside of these indexes, we do, and again, I apologize, my Adobe is doing something wrong there. The committee acknowledged that there is a brokerage account that allows participants to invest in basically whatever they want. And the brokerage account is not subject to fiduciary oversight. So we as a committee, you as a board, do not have responsibility to monitor everything in a brokerage account. So we have a brokerage account in place if participants want something different. We also reviewed our annual working group administrative report. As a brief reminder, the working group is a subset of the committee where we actually do an annual meeting and we dig into the nuanced administration of the plan. We're looking at things like, the plan document, forfeiture accounts, lost participants, the detailed administrative side of the retirement plan. One of the other things we do is we do a share class review, and we were able to identify the Conestoga Fund, where we could find a different share class of the same product that had a net expense ratio of 0.2 less. So we agreed to remove that. We identified forfeitures in the 457 plan of 231,000. So first off, what are forfeitures? So there's a vesting schedule for the employer contribution, meaning employees have to be here for a certain period of time to earn the full employer contribution. Prior to my joining, the 457B plan had employee and employer contributions in there. As part of the working group, we discovered that there was $231,000 of forfeitures, which can be used to pay future plan expenses. Now, for anyone that knows retirement plans, and I'm sure there's 2 or 3 people there saying, well, can't we use it to offset employer contributions? There are no more employer contributions to the 457. The employer contributions go to the 401A. So the IRS allows you to use forfeitures to offset future employer contributions, of which there are none, into the 457, or to offset plan expenses. So effectively, we have $231,000 of an asset that's available to use to pay consulting and administrative fees. So you have a decade worth of fees that are already paid for through that plan. We also looked at missing participants. So these are folks where they're not getting delivered their mail, or their emails are bouncing back. And the 457B plan had 128 participants that were not getting communications. The 401A plan had 212 participants that were not getting communications. And the committee elected to engage Fidelity to locate missing participants using the Department of Labor's guidance. So we've outsourced to a professional firm to try to identify and locate those missing participants. And I'll give you an update next time we speak, but unfortunately, we're looking at, high hopes would be maybe 1/3 of those participants can be found. But I will also echo Dee Dee Holmes in noting that sometimes the people really do live there, but the local mail delivery service isn't necessarily accurate due to snow and/or mailboxes getting knocked down and things like that. So we will actively monitor the delivery of communications to these participants who historically have not received those communications. We also negotiated 5 additional days of on-site education at no extra expense. So we were able to get Fidelity to agree to come to campus, to the hospital, to do a full day of education and or one-on-one meetings, and again, at no additional expense. And we did confirm the adequacy of the fiduciary insurance policy to protect both the board members as well as the committee members in case of any lawsuits. We also reviewed the inaugural working group education report. This is where we spend detailed time going through demographics, talking with HR about what their needs are, open enrollments, beneficiaries, market volatility, enrollment stats. And we agreed that we were going to create a planned mix of virtual and in-person appointments throughout the coming year. We're going to promote one-on-one consultations with a Fidelity advisor, virtual really. Fidelity has a team of people that can meet with participants at their leisure rather than during the work hour. And we agreed to distribute numerous education flyers on various different topics. And then we did some fiduciary education on missing participants and why it's important to we don't have to succeed, but to attempt to locate those missing participants. At the Q4 meeting, the committee reviewed the performance of the investments, and that's where it first came out to say, hey, Invesco's on the watch list. The JP Morgan comments I made earlier were postscript, but I thought it would be important for you to know. We also discussed the 2023 regulatory update, going through the DOL, the IRS, plaintiffs' attorneys, the DOL, the IRS, legal court cases, as well as Congress. And Congress had a whopper of a year. So we talked about the Secure Act 2.0. The only mandatory position, and I emphasize that because there were about 100 provisions that affect retirement plans. And there are no record keepers in the country that are ready to administer all of them. So we talk about what is mandatory, and what is optional. And what is mandatory is what is mandatory. And what is optional is what is optional. And what is optional is what is optional. And what is mandatory is what is mandatory. And what is optional is what is optional. And what is mandatory is what is mandatory. And what is optional is what is optional. And what is mandatory is what is mandatory. And what is optional is what is optional. And what is mandatory is what is optional. And what is optional is what is optional. And what is mandatory is what is optional. And what is optional is what is optional. And what is mandatory 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 is what and then we start talking about what is optional. The only mandatory provision that was needed actually did get deferred to January 1 of 2026, so we have some time. That allows us to focus on the provisions of Secure Act that we think are in the best interest of participants. And we're going to continue to discuss these provisions over time, but the reality is they're so comprehensive that even Fidelity, the largest record keeper with the most amount of money to invest in record keeping programming, they're not ready to administer all the provisions. So as provisions become available, we'll discuss them with an emphasis on discussing each one of these at Q4. And I say each one of these, I should have said each Q4, because there are multiple rollout years. Some were effective in 23, 24, 25, 26, 27, and 33. So each Q4 we will meet to discuss to make sure that we are adhering to the new regulations. And the good news, no legally required amendments for 2024, so no actions that we had to take. And then we did some education on settler, which are basically business decisions versus fiduciary decisions, to help the committee understand the difference between, hey, what is a fiduciary issue, which has to be operated in the best interest of participants, and what is a business decision, which does not necessarily have to be operated in the best interest of participants, but can be decided by the employer. Those are my prepared comments for today. I welcome questions.
Any questions from our board regarding the retirement? Okay, we have nothing from the board. Anything from our audience? Okay, you did a great job, Brian. Nobody has questions.
Thank you. Hey, Dale, Crocker Highlands is flooding right now. The streets are just flooding.
Uh-oh.
Thank you, everybody. Take care. We'll
We
see you
used to be neighbors in the Bay Area.
Yeah. Bye, everybody.
Well, thank you very much, Brian.
Thank you.
Okay, and that was a board discussion, so there's no motion needed. Then we're going to move on to 15, and this is a motion for the board action. It's an operating agreement of Sierra Health Collaborative, and our CEO, President Harry Weiss, is going to present.
Good evening, Chair and members of the Board of Directors. We're pleased to bring to you a discussion about a very important principle in healthcare, and that's friendly collaboratives. And over the years, our health system has really worked to cheerlead and build friendships on a 360-degree basis around our health system, and really cheerlead that access to great health care always continues in these various communities. And there are a great number of freestanding hospitals on a 360-degree basis around us. Tonight, our focus is on a topic that we brought to your board back around October of 2020, and that would have been a little bit into the COVID era, and that is the group called Sierra Health Collaborative LLC. Our group at that time had three other regional interested parties, and the growth has increased to 4 additional. And so those collaborative partners who are very interested in this is Barton Health, South Lake Tahoe, Carson Tahoe Health out of Carson City, Mammoth District Hospital out of Mammoth, and Marshall District Hospital out of Placerville. Our various hospitals were slowed down a bit because of the pandemic, but also because 2 of these entities also started experiencing losses, and one also had a CEO turnover. So there's great excitement about really getting this program alive and functioning, and so there's a target date that each of the hospitals are suggesting as they've been taking it to their boards in February and some in March to start this collaborative officially April 1 of 2024. The investment amount that we shared back in 2020 was $50,000, and to capitalize in that amount is still the same today. This will be an operating entity that's a Delaware-based LLC, and the principal place of business then will be in State Line, Nevada, which happens to be an overhead or administrative office area for Barton Health. So that will be our local office separate from the Delaware-based LLC that's being proposed. So I hope you have had a chance to look it over. It's a very thoughtful agreement that probably has had about 5 to 10 iterations, and various legal counsels have examined it from the different entities. I think one is still looking at it a bit. So it is a recommendation from staff, if our board is willing and didn't have questions, that this operating agreement be approved in principle as presented. As possible, there could be some minor nuance changes, but it should be substantially correct. And of course, you did approve the 50,000 earlier, but if you'd like to reaffirm that, that's fine as well. I think other just important notes, as our group has talked, we thought it'd be interesting maybe at some point during calendar 24 if the chairs of each of the hospitals of these 5 entities could kind of get together and meet each other and work together. And the key focus of a collaborative is really to accomplish a principle where 1 + 1 could be 3. Are there things we can do to better preserve health care in each of these markets? Are there things we can do to lower overhead expenses? And areas, one of the first areas of interest that's been growing is certainly IT and healthcare. And 4 of the 5 of us use Epic, and we use it from all different sources. And there's probably 4 different levels of happiness relative to how it's working too. And there seems to be a real growing interest with how we source Epic. And so kind of it's possible that on a sequential basis, there might be another one join our source, and then another one in a couple years, and another one, because the cost and function doesn't seem to be working quite as well as our Epic partners and so forth. But there's a variety of things, whether it's labor productivity, whether it's cost efficiencies, or just any program efficiency. There may be opportunities in medical staff coverages. This tool doesn't really limit us, in any lawful activity to really help these organizations shine with a challenging future that lies ahead. So again, just our recommendation is if it's your pleasure that that you would move to approve the operating agreement in principle, and we will keep it moving forward, along with maybe the $50,000 investment.
Larry, just to get some of the concept here, is this the idea of like a buying cooperative, so that essentially we would have better bargaining power with some of the contracts, including our IT?
We do use national group purchasing, but there are ways that we can come together to maybe lower the cost of supplies and drugs and so forth even further here. And so I think certainly group purchasing is one thing. I think 2 of the 5 are using pretty similar techniques right now, or sources, just for example in group purchasing. But so that is also a topic. So everything is on the table to help us succeed, in the future.
Harry, if I remember correctly, at one time we talked about a billing cooperative. Is that also still on the agenda?
It can be. And the one thing I want to really share in terms of a collaborative versus being a formal integrated system, every act that happens here, it's voluntary, whether a hospital, one of the 5, chooses to participate in that program. So it's not like you're a part of HCA or Dignity or Adventist Health or any of these others where you must do everything. It's purely voluntary on behalf of each facility, and that's the beauty of the collaborative part.
So the operating agreement is just formalizing what has been existing right along?
It's really, we haven't really gone live yet because of the pandemic, losses and turnover, so we got that approval back in 2020. We've been continuing to meet and dialogue and then go through this, but we're really trying to put some life in this thing around April 1 and potentially hire a part-time executive director that would then be shared throughout, and there'll be work done on budgeting and strategic planning and really prioritizing what are those top 2 or 3 things that can begin to add value to an organization. So there's been a lot of kind of cheerleading at this point and beginning to develop this, but we want to put some legs on it now.
So here, as we talk about hiring a director and things like that, is it the intention that, I know that the initial capital contributions are going to be divided equally. Is it the intention of the group that all future capital contributions be equal amongst the 5 members?
I think that the capital contributions would probably be pretty infrequent, but just like with our Workforce Housing Agency, there will be an annual budget prepared, and we would probably, each of the 5 partners, share in that on some equitable basis. And it would have a very low-cost budget initially, but we would share in that at some expense there. And we don't know what that would be because it hasn't been defined yet.
But it would be, at this point in time, assumed that that would be spread evenly
Right.
amongst the 5 partners.
Right, and so we each have one vote in this, and that's the structure of our Workforce Housing Agency as well.
So I did have a clarifying question on it. There was a provision in there, if there was an imbalance in capital contributions, then the number of units held by a member would shift.
Right.
But that wouldn't shift voting power.
No.
It would still be 1 vote per member. Okay, so that would likely only affect if there was if the entity were to dissolve and payouts, that would be based on the unit basis.
Right.
Okay. Okay.
And that's the principle we use with the Workforce Housing Agency. Each one gets 1 vote too.
Okay.
And is there going to be an annual fee as well?
There could be a fee to meet operating budget requirements, because you want to make sure you preserve your working capital investment. Some of that could be used towards the first year, but we need to do a budget and a strategic plan and see what are those final, agendas that we want to take on. And so there could be some nominal fees that would come towards each of the partners here.
Any other questions from our board regarding the LLC?
Well, just clarifying, because the 50,000 to me actually seems relatively low.
Right.
So, the intent would be then, it would be in-kind resources from each of the members
Right.
to contribute
Right.
effort, okay.
And all of the time and effort to date is not being charged against the capitalization either.
Right, okay.
Any comments or questions from our audience?
Now it's on. Okay. I'll identify myself again, Deirdre Henderson. As we took a look at the operating agreement for Sierra Health Collaborative, we noticed that the purposes of the collaborative, and I'm going to shorten them here, are to collaborate with respect to best practices related to healthcare operations and care delivery, and overall care of patients in the communities served by the members, to identify, prioritize, and pursue cost-saving initiatives for the benefit of the members, and to evaluate population health initiatives and pursue those that provide a substantial benefit to our patients. So it seemed to us that this collaborative provides a real opportunity for the members to work together and learn from each other with respect to climate action and the health effects of climate change. And we urge you to take advantage of that opportunity with this collaborative. Everyone in healthcare these days is talking about the need to reduce carbon emissions, is talking about the health effects of climate change. So I'm sure that there will be opportunities as you begin to work with the other members. Thank you.
Thank you. Any other comments?
I just had a quick question. Harry, who would kind of develop the agenda for the projects that the collaborative would undertake?
They come forward from the members. The Board of Managers is estimated to be made up of the 5 CEOs, and they are recommending that I chair it for the first 2 years of its startup life, and so I'll be working with all 5 partners to see, do we have the most important elements that they would want to cover.
Will there be a staff component to the organization?
There'll be probably a least part-time person, so that we don't have to save costs, so we don't have to develop our own payroll and HR benefits. So that would be leased over from one of the hospitals on a part-time basis. Once we choose the person with the right skill set, it would be leased at cost over to this entity.
So this is going to focus primarily on projects and...
Right. There's a lot of excitement about what we can do together as 5 freestanding facilities to make ourselves more effective.
So Harry, how often would the group meet?
I would say probably at least quarterly, if not monthly. And once we're started up, we'll probably meet monthly. In the past, we've met at least quarterly.
And then will the board get any kind of a report on actions being taken?
I think what we'd like to do is have a periodic interval where we bring back, these are things that we've done, during the last 6 months or the last year. Once we really start kicking something off, just like we've tried to do with workforce housing, you deserve to hear a report on its progress. So at least no less frequently than annually, you should hear, what's going on.
Okay.
And in that regard, can climate change be one of the things that can be considered by this group?
I think certainly as it develops a strategic plan and all of those things, those are very relevant topics.
If there's no further questions, this is a item for action. So can I have a motion to approve the operating agreement of Sierra Health Collaborative LLC as presented?
Move approval?
Can I have a second also?
I'll second.
So it's been moved by Director Brown, seconded by Director McGarry, that we approve the operating agreement of Sierra Health Collaborative LLC as presented. All in favor?
Aye.
All opposed? So the motion carries and the agreement has been approved, and we look forward to hearing really the work that's being done. We're investing time and money into it.
Right.
So we'd like to see some outcomes.
You bet. Thank you.
Okay. There was nothing pulled from our consent calendar, so our next item would be board committee reports, and I think the Community Engagement Committee was the only one that has met so far. So can we have a report?
Absolutely. The Community Engagement Committee met, the foundation met as well this month, in fact, back-to-back meetings in this room. The CEC meeting, a big part of it was really what we call part 2 of identifying activities already underway, right? And I won't detail those because it was about an hour-and-a-half presentation of all the things that are being done, and that was a part 2, right? So fantastic. Again, really just level setting on what the committee is, where we need to go, what we need to do. Everyone brings a different understanding of even what community health is and what community engagement is. So great to get that input from multiple groups across the organization. We also talked about, well, I guess in part of that was talking about some of the ski area partnerships that we have. TART Connect was some of the other, I think, areas that were highlighted beyond the sort of internal activities. I think that's probably the highlight from that was just kind of going over all the level setting and baseline of that. And then on the foundation, there was a vote to sort of change. I think the groups really struggled to kind of get some energy around their meetings and their purpose and what they're trying to get done. And they felt that being in a sort of structured, agenda-driven environment wasn't creating the sort of free flow of thought that they wanted. And so they voted to make at least one meeting every quarter be effectively an offsite, where it could be a brainstorming session around how we best, raise funds, run events, et cetera. So I think everyone was probably excited to change that up a little bit. And they obviously have a lot more leeway than, for example, the district board does in how they run their meetings. So, but the goal is to drive more energy, more creativity. Let's see, they also talked about November 10th for a 75-year celebration. And then also doing some sort of an event, I think it was in October, I didn't note the date here.
That's October 6th, I think.
October 6th. So the November 10th event would be more of a gala, more of a fancy event. The October event is more of a community, would be at one of the regional parks, much more accessible to families and everyone in the community. And then Dylan gave a great presentation on the Gateway Center and the plans for that. The foundation had asked in general that they be more informed of some of the bigger activities that the hospital's taking, so that they could, for example, one of the things was talked about was, is there a naming opportunity, for Gateway Center? Is that something the foundation could be working on? So it was great. They really well received on that presentation. That's it.
Okay. Are there any board member reports?
Yeah. I made my monthly report to the Incline Village Hospital Foundation. They're particularly excited right now because the governor of Nevada is highly supportive of rural health care and apparently has some money to spend. And I know admin is working up some ideas for what we might use that money for if we were able to get it. Perhaps the purchase of some land, perhaps the purchase of a building. They would like the opportunity to provide some workforce housing, whether it be temporary workforce housing for physicians who are working in the area. So anyway, more to come on that. Obviously, we don't want to ask for funds from the governor if in fact we don't have a specific use for them. So coming up with something specific is what we're trying to do right now. I don't know if you want to add anything to that, Harry.
I think the key thing is the upfront costs, and does it really fit our strike zone of our future agenda, so that you could really start something and conclude it and make it meaningful, versus just have money up front but then really not have the significant capital to follow it all the way through. So it's a very careful process.
Okay.
Okay, and I,
Excuse me, just a minute, Alice. That sort of just sparks a question in my mind, and that is whether or not at some point in time we can have a discussion around the visioning or the master plan for Incline Village. In terms of future space needs, we talk about the master plan for Truckee, but we really haven't done any level of futuristic thinking around Incline Village Hospital and what their needs are going to be, and I think that would be very helpful.
yeah, thank you for that thought. I always think of them as part of us and not really having the same needs.
No, it might be a trade secret.
Do you want to share what you're,
Oh,
Yeah, I'm just trying to think whether that's appropriate for our retreat, or whether that's something we would want to do in open session and have a presentation.
Typically, we do include, their list of items has been smaller, like the parking, the surgical expansion. Those were all things there. Now the land issue has popped up, but your point is really well received, because many of our master plan items dealt within the envelope of the hospital, but we did very specifically note parking, surgical changes. Parking was an outside the hospital change that was in our master plan, but we will make sure that it gets its fair share, that we emphasize it, because we're certainly not trying to shortchange it in any way.
maybe just to know what the capacity,
Right.
what the future capacity is.
Right.
of the space
Sure.
that we already have.
Right.
okay. Okay. And then my last report will be on the Tahoe Truckee Homeless Advisory Committee. Ted Owens, our business director, and Louis Ward, our COO, and myself, we were all on the advisory committee, and I just have to let you know, it is really a well-run machine right now. They are putting together a report, a framework, with some methodology and looking at outcomes. They have data that they're collecting and trying to really compile it to see if they can find a gap analysis, or who is it that we're serving, what kind of individuals or families are unhoused, because one solution doesn't fit all. So again, they've got an advisory board that's going to look at the data and give us where the gaps are so that we can look at moving forward. All this currently is being funded by a grant, but I think the grant is up this summer. I think they've got like 3 more meetings under the grant, and they're moving quite quickly on this. There's more to be seen on what's going to happen between Placer and Nevada County. The counties are all involved in it. The town of Truckee's involved in it, and anybody that's got any kind of interaction with the homeless. So that's going to be more to come on that. And that's all we have. And if there's no other further comments, we'll close open session and go back into closed session. So thank all of you. So we need to wait till Lori.
We just need a couple of minutes to
Yep.
pull all